Hello, my name is LeAnn Burgau. I'm the owner of Burgau Insurance Agency. We're an independent agency specializing in Medicare health and prescription plan options. We're a local agency with offices in both Perham and Detroit Lakes. At Burgau Insurance, our goal is to educate our clients so that they understand Medicare, the costs associated with Medicare, and the options available to them so that they can maximize the benefits of their plans. I'd like to welcome you to the 9th video in a series of short videos designed to answer your questions about Medicare. Today I'd like to spend some time talking about the Inflation Reduction Act of 2022 and how this act and laws affect Medicare clients. The Act includes several provisions to lower prescription costs for Medicare clients and also to reduce costs on prescription drugs by the federal government. First, starting in 2023, the federal government will be required to negotiate drug prices covered under Medicare Part D and Medicare Part B with the pharmaceutical companies. Negotiations will span over the next 2 years, with the new prices being implemented in the year 2026. Next, it will require drug companies to pay rebates to Medicare if prices for drugs increase faster than inflation. This will also begin in 2023. To date, Medicare has had no authority to limit annual increases in the prices of drugs covered under Medicare B and Medicare D. One of the most significant changes that this law implements is a cap on out-of-pocket spending for Medicare Part D enrollees. Beginning in the year 2025, there will be a $2,000 out-of-pocket cap on drug costs for people enrolled in Part D. This means that after a client reaches that $2,000 out-of-pocket cost, they will have no more coinsurances or copays on their drugs for the remainder of that year. They will still have to pay their premiums. Currently, when someone hits catastrophic coverage with their Part D plan, which is the 4th stage in Part D coverage, they pay a 5% coinsurance on the total cost of their drugs. In 2024, that 5% coinsurance will be eliminated. The next provision of the Act limits monthly cost sharing for insulin to $35 per month for Medicare clients. All Medicare Part D plans and Medicare Advantage plans will be required to charge no more than $35 per month for insulin covered under their plan. This doesn't mean that the plan has to cover all insulin, so it is important to check your plan every year to make sure the insulin is covered or is on that plan's formulary for the year. Another big change, which starts January 1st, 2023, is the elimination of cost sharing for adult vaccines. Some of the most common examples would be the Shingrix vaccine and tetanus. Those will have a $0 copay and will not be subject to the deductible on Part D coverages. These are just some of the ways that the Inflation Reduction Act will affect your Medicare coverage. It's important to know these changes so that you are able to make an educated decision in your plan choice during this year's annual election period, which begins October 15th and runs through December 7th each year. One more topic I would like to briefly touch on are the changes that Medicare has made in compliance and marketing. These changes affect all agencies and all agents that market Medicare Part D prescription plans and Medicare Advantage plans. Beginning October 1st, 2022, all calls between an agent and a Medicare client need to be recorded, and these calls need to be stored for 10 years. These new regulations were put in place mainly due to all of the complaints Medicare has received on those TV commercials that we've all seen. Also, within 60 seconds into an appointment or phone call, the following disclaimer must be read to the client. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. This disclaimer has to be read to every client, whether you carry one plan in the area or if you cover 99% of the plans. As always, feel free to call Burgau Insurance 877-724-2365 to ask any of your Medicare questions. One of our licensed agents would be happy to talk with you, and we never sell or share your information. And we never charge for any of our services. Burgau Insurance is a local independent agency specializing in Medicare health and prescription Part D plans. Thank you for your time today and look forward to more videos answering your Medicare questions.